We do have a lot of time for questions and discussion, actually, so we hope that you have some things you want to share with us. Feel free to raise your hand if you want to come off mute, and we can invite you to come off mute, or you can type your questions or comments in the chat. We did get a couple of questions in the chat. I wanted to kind of go back to that. So there's a question about, do these modules come for training have lesson plans? And I had a short response there. And Sarah, I haven't read through your comment back, but we do have some sample schedules in the toolkit that you can use. Many of you might be familiar with the Project First Line trainings that we did live direct to CNA back in 2021, early 2022. Yeah, that's right. And then for those, we tried to do them, 1 hour sessions with your CNA, but we know that getting an hour is really hard to do. So really these modules have been designed so that you can give really short 20 to 30 minute full presentations, or as Shannon, Aurora, and Sophie demonstrated, you really can extract what you need at that time, provide like a 5-minute huddle or even a just in time, or just like a pop quiz in your facility. So whatever, you can commit to, I think that's where you can start. Any of the Project First Line staff want to add to that? I see some shaking heads. Awesome. I don't see any other questions in the chat. Again, just a reminder, the toolkit will be available at the conclusion of this week's webinars. That way everyone can join us and get the sneak peek, and then we'll launch it more widely. But I want to now invite Shantala Ahania, who's one of our HAI program infection preventionists, to help moderate today's discussion. And actually, I do see a question in the chat, Shantala. Maybe this can be your first one. It was a direct message to me. Any suggestion how to do a bath, not a bed bath, to alert residents on ESPs, or to alert resident on ESP? And I can...
Thank you, Erin. So my understanding, the question is any residents who are on ESP who's alert, and the recommendation for bath, or is that the question? That's my understanding. Is that
right? Shine, if you can come off mute and
Hi, hello.
Hi, Shan. Good.
Hi. Hello. Yeah. So I just want to ask a question here. Hello, guys. I just want to ask a question in regards of students have that in enhanced standard precaution isolation. If they request like a regular bath, how would I educate my CNAs? Right now, I was telling them that when they're preparing their residents to come out of the room, they have to wear a gown because they are doing patient care, and then they have to remove that before going out of the room, and then going inside the shower, they have to put another one. So right now, that's where we are. But I was reading the context of frequent asked question in regards of ESP. I don't see any like specific rules in regards of showering patient. So any suggestions?
Thank you, Shan. I think that we have posted already the first portion of the FAQs, and these questions will be posted again in our second edition. So we are working on it. I think one of the things which you are absolutely right. When the staff are preparing the resident to go for a bath or go for a shower, so then they need to use gown and gloves to prepare them to bring them, if they're bringing them on a wheelchair or in a shower chair. So once they prep them, then they have to remove their gown and gloves, perform hand hygiene, wheel them into the shower room, and then they should have access to gown and gloves there. So when they're giving the shower. So that also goes for your standard precaution, right? So for anybody not on an ESP, when they're showering the resident, they use gown and gloves. So your process is perfect, and that is, we are going to answer that question in our second edition. So it will be available.
Okay, thank you so much. I'm gonna for sure include that in our huddle tomorrow morning, just to clarify with our students. Thank you so much, guys.
Yes. So do we see any other questions? I don't see. But I do have to our speakers. I do have a question. Shannon, this question for you. So why it is so important to share or to provide the feedback to the frontline staff? Yes, we conduct all the adherence monitoring, but why it is important? Can you share?
Yes, that's a great question, Shantala. It's super crucial to provide the feedback to your staff on adherence monitoring audits, especially when you see the gaps, because it really helps to have staff understand the reasoning behind the gaps. Is it because they don't have the tools, or is there an opportunity to retrain on the ICP practices? It's really just showing the reasoning behind those gaps. Do you have anything else you could add, though?
I think it's since we all know we have to think about how we are teaching our staff, especially adult learning process, right? So they learn differently. If we do the adherence monitoring, we are collecting the data, but no one is talking about it and no one is involving the staff, the reason behind the gaps. So it's very hard for you to, as an IP or DSD or the leadership, to implement. Do we have all the tools available? So for example, hand hygiene. You observe staff not doing hand hygiene when they're going inside the room. And your expectation is they have to do hand hygiene going inside the room. But where is the hand sanitizer? Do they have, is it outside every room? Or if it is at the inside the room, where exactly is it? It's behind the curtain, which is not reachable, because we know all the residents who has this is their home. Their room is their home. So they have, sometimes we have seen people with everybody can relate to it, right? Everybody is ordering from Amazon. You have boxes and boxes in their room. So the staff doesn't have access to stuff. So you really need to look at whether they have the tools. So as Shannon mentioned, when giving that feedback, right? Why didn't you do hand hygiene, whether it is one-on-one or it is in the huddle, as Cheyenne said. So she's going to bring up the ESP shower process, shower process for the ESP, anybody who's on the residents on the ESP precaution. Just like that, you identify the gap. The feedback will help you to identify the gap, and then the interventions. So so you're creating a focus group among your staff. Aurora, Sophie, anything else to add? Erin? Okay.
I think actually one thing. So we did share in the chat the adherence monitoring website we have for the HAI programs website. And on there, there's a number of tools. And actually what we will hopefully be adding soon are these feedback tools that will allow you to just input information into like a Word document, and it will automatically graph a figure for you to show any trends in like change in hand hygiene practices and so on. So look for that, bookmark that page. I think it's a good resource to have.
Thank you, Erin. So I think I see a couple of questions on our chat. So the one question is, if a resident who is on ESP receiving therapy and is receiving ambulation assistance in the hallway, does the therapist need to wear a gown? No, we are preparing the resident for the therapy, so they have a clean gown on, or they have changed their personal clothing. They have performed their hand hygiene. So once you prepare the resident to come out of the room, so you don't really need to wear your PPE in the hallway. I think there is a second question. The second question is, Julia has a question regarding, I have warming food for residents and storing their food. Can food that has been eaten from be rewarmed or stored? Do you have any education regarding this? Shannon, Aurora, do you want to take that, or do you want me to take that question?
You can take it.
Thank you.
And I'll just briefly comment too. In the CNA training, we don't have anything that covers that, but maybe Shantala can provide insight on some resources for you.
Thank you, Erin. So I think it's we have to follow the CMS food safety recommendation. What does your policy says? You have to go back to your policy, especially your nutrition department, work with the nutrition department to making sure, because there are certain foods we don't want to reheat. So when you reheat, so that can cause foodborne illness. So you really need to work with your nutrition team, your kitchen team, to making sure that what does the policy says when the patient doesn't eat on timely manner, but they want to reheat, or so you really need to follow the facility policy. And we can address this in our office hour next week. When we have our office hour, we can bring back there is a CMS food safety guidelines for the long-term care facilities. We can bring that back to you guys. And don't see any other, do we have other questions?
I don't see anything on my end. Does anyone want to raise their hand and come off mute for any questions? Feel free to do so. Or just chime in. All right.
Okay. I don't see, so I do have one more thing to ask. Aurora, so Shannon talked about the feedback, right? And how important is the feedback? How often do you think we need to provide that feedback? So do we need to, because as we saw, the comments was time restraints. So they didn't have enough time. So do you think that they need to provide the feedback on a daily basis or a weekly basis? What do you think about? How do you think is the IP staff with their time so they can still reach out to the frontline staff?
Yes, great question. So as we have given several ways to share your data and where you can post it or place it, you can do daily or weekly or even monthly reporting, and as needed. Consistency is the key factor here. So you can have it in a bulletin board or report monthly, because the feedback, you want to make sure that they have that available so they can start implementing changes and improving if there was some concerns regarding their IPC practice. So they want to make sure they do that as often. Do you think that's okay, or should they do it more often?
I think it depending upon what's happening. If you have right now, so we are implementing. You have some of you have already attended, or many of you have already attended the ESP training, the UTI prevention training, and now it's something, the ESP is a new concept for your facility. So then you may have to incorporate some of these elements on a daily basis, because we don't want to overburden the staff with all the information at one time, and then to say, oh, I don't want to do that, I want to quit, right? Now you had to go and look for the staff. So we don't want to do that. So what is your priority? Just like, 1 week, I'm going to talk to therapy staff, making sure that all my therapy staff are perfect, so they know, they understand. So it's up to the facility, as Aurora, you mentioned about the risk assessment, right? So risk assessment, what is your staff knowledge, engagement? There are some facilities we have seen where the CNAs are very well engaged. So they take the lead upon themselves and they do everything. Whereas some facilities, it's my 8-hour job or a 12-hour job, and then they're not really involved. So, and we saw that some of them are lacking interest. So engaging them, how do you engage them? So it's a piecemeal, maybe it's a one element at a time, or maybe you need to have a classroom setting. So creating a focus group to say, how do I train my staff? You have Erin and Aurora, Shannon, and Sophie, they have shared all the toolkits. They will be sharing all the toolkits. Now you had to look at, I have all the information available, but what is what my facility needs? So you're doing the risk assessment for that element. So how are they, do I need to do a classroom setting so that we have everybody comes to a mandatory meeting? Or do we need to do a virtual training? So that's up to your facility to decide. Work with your leadership, and then always try to find a CNA who is eager to learn, who is ready, willing to share as a secret shopper for you to train this, not just for the hand hygiene, so to help you. And then always making sure that having that data available on a whiteboard, right? So you do have a whiteboard, the notice board. So having that information, what was your hand hygiene data? Where was it lacking, right? So just to give them, so then it's somebody who has gone on vacation for a month or a week or a month. So when they come back, they should know what was happening in the building, right? So that's kind of information. Whether for the registry staff, when they look at the board, they should be able to see, okay, so these are the things which this facility is focusing on. And because when they go to facility B, their focus may be different. But if they're taking the information from what they worked in facility A, that is not beneficial for the next building, right? So for each of your buildings, so you really need to see what is your plan for monthly plan, or create a monthly plan. You talk about the lesson plan, right? So then what is your monthly plan to train your staff so that you have it available and provide that information? You all do the group text for all of your staff. So maybe you can do a group text. Maybe it's a screensaver. So several ways of doing it. But as Aurora mentioned, doing a risk assessment for training needs, right? So when you talk about the risk assessment, it's a big word and we all get scared. Okay, how do I do that, right? No, what is the need? So do that and then come up with your lesson plan. Hopefully that helps. If anybody has any questions, come out of mute or share. If somebody has done, many of you have done a great job transitioning from COVID, right? Now to post-COVID, pre-COVID to COVID and post-COVID. You have done a lot of great work. We would love for you to share your stories and your plans.